Hello, welcome to Sonography-Radiology training channel. This series of videos is about normal skull X-ray findings. This is the second video in this video series with title of Normal Skull X-ray Findings, Simulate Disease Part 2. Like video part 1, we will review a few cases of normal skull X-ray findings together. Case 1. This lateral skull X-ray is related to a 4-year-old boy. In this image, we can see multiple lucencies separate from each other by thick cortical bone, but they show prominent digital markings. Convolutional markings are normal impressions of the Xray on the inner table of the skull. They appear during the period of rapid brain development, typically between 3 and 7 years of age. They are seen predominantly posteriorly but may be seen throughout the skull. They do not in themselves necessarily reflect increased intracranial pressure. Is there any differential diagnosis for prominent digital markings? We have two important differential diagnoses. At first, Cooper-Beaton skull. Cooper-Beaton skull, also known as Beaton silver skull or Beaton brass skull, refers to the prominence of convolutional markings or giral impressions on the inner table of the skull and over the more anterior aspect, but another one may be seen throughout the skull wallet. Underlying cause is thought to be related to increased intracranial pressure resulting from such processes as craniosynostosis, obstructive hydrocephalus, and or intracranial masses. However, the Cooper-Beaton appearance of the skull has poor sensitivity in detecting increased intracranial pressure. As such, an appearance can also be seen in normal patients. Another important differential diagnosis is Lucan Shidel skull. Lucan Shidel skull, also known as lacunal skull or cranial lacunae, is a dysplasia of the membranous skull wallet and is associated with Chiari-2 malformation, which is seen in up to 80% of these cases. The inner table is more affected than the outer, with regions of apparent thinning corresponding to unossified fibrous bone of the skull wallet. If particularly severe, with the individual lacunae coalescing into larger defects, the term craniofenestrate is used. As you can see, these three entities are same together, but it's important to note that this skull appearance can be seen in normal children during periods of rapid brain growth between 3 and 7 years old. Case 2. This image shows two well-defined sclerotic lesions with a lucent halo similar to sequestration. But really they are vascular channels in the parietal bone simulating Botton Sistra. Direct vascular channels connect skull bone marrow and the brain surface, as you can see in this beautiful electronic microscopic image. A Botton sequestrum is a small sequestrum of the devascularized bone surrounded by lucency. Also classically described in osteomyelitis and eosinophilic granuloma, it's also occasionally seen in fibrosarcoma and lymphoma. Another example of vascular channels in the frontal bone simulating Botton sequestra. Case 3. This lateral skull image shows prominent diploid vascular pattern in a child. Another example of unusual calvarial vascular pattern simulating fractures. Case 4. These images show multiple lytic lesions. But there are two examples of multiple diploid venous legs which may simulate metastatic neoplasm. Both patients showed no change on long-term follow-up examinations. Venous lacunae, also known as venous legs, are enlarged venous spaces within the skull, most often in parasagittal region. They are normal variants and their primary importance is that they may mimic lytic lesions. Case 5. Two examples of prominent but normal diploid vascular patterns. This image shows a prominent but normal groove for the sphenoparietal venous sinus. Another one, in lateral skull image, we can see vascular groove for sphenoparietal sinus simulating fracture. Another example of venous vascular groove in the frontal bone, which may be mistaken for fracture. Now, I suggest two others of my videos that are close to this video in terms of matter. And thank you for your attention.